Here with us now is Dr. Cole Bueller, infectious disease specialist at IU Health. Dr. Bueller, welcome.
Hey, thanks for having me.
So Merck came out with a new study, phase 2 trial, about a new drug that they are saying could stop this coronavirus in its tracks. So what is this? What is this drug, and why would they be saying this? What does it mean? What is it?
Yeah, so the drug's called molnupiravir, and I had to practice saying it like 50 times before I decided to talk to you to make it as hard as possible. But this is essentially a way for a medication to slow down the replication of the virus. So it stalls its ability to make more copies of itself. And this is potentially encouraging because the studies show that that's exactly what happens, that in patients who got the medication compared to patients who got placebo, they stop shedding virus faster.
Do we know, based on the results, how is this significantly faster?
Yeah, it was significantly faster. The one thing that I would mention is that it's really hard to know what that's going to equate to at this point. It's still very, very early, and I'm cautiously optimistic here. I think that we need a medication like this that can be given by mouth and that has effects on the virus. But really what we need is to link a medication like this and have data on the potential for the medication to decrease symptoms, to decrease transmission events, to decrease hospitalizations and deaths. And we don't yet have that data. So until that comes out, this is still just a promising potential as opposed to something that people should start hanging their hats on.
So speaking of promising potential and also cautiously optimistic, I think that's a very important point that you bring to our viewers, your point of view, Dr. Bueller. Well, I read in the news release that Merck made a statement and also on the news that this could be, well, it's going to be in pill form. I mean, that's kind of their thought. It is in pill form. It could be easily administered rather than some sort of infusion, and likening it like Theraflu, something that you would be prescribed for the flu. And it's too early to tell, like you said, but what are your thoughts on those comments?
If it were a medication that ended up turning into Tamiflu or being like Tamiflu, I think that would be a big victory. Tamiflu's main benefit is that if you give it early enough, it decreases your symptoms that you have from COVID, from influenza. If we had similar outcomes for this medication, that would be a lot better than anything that we have right now. So I'll definitely take it. However, I would also like to see if it decreases people's chance of getting admitted to the hospital. I'd also like to see if it decreased people's chance, and this is probably number one, of spreading the virus. Something that's very interesting with this medication is the fact that it decreases viral replication, and could it be used to decrease transmission events if you take it prophylactically? So does it protect you from getting it? So if you're working in a nursing home or if you live in a nursing home, does taking this medication stop you from getting COVID if there's COVID around in the nursing home? So all that has to be defined. I think it's very promising. We're waiting for this clinically, something to make an impact on the outpatient side. But right now it's probably premature to say one way or another which direction this is going to go.
Mm-hmm. That's very interesting. So you're saying it could be a preventative measure.
Yep. And I think that they're entertaining that right now. They'd love to be able to market it in that direction because, again, we just have no tools in the tool belt there. And at least just based on the mechanism of action of the medication, it seems feasible that this medication could potentially be used as something that prevents you from getting COVID if you're in a higher risk situation. But all that, again, needs to be defined.
Mm-hmm. And if let's say you do contract COVID-19, and based on their findings, they say it stops replication, it stops this cascade of sort of inflammation throughout the body, because we know those are a lot of inflammation. I mean, this is a disease or virus of inflammation, but if you contract it and it still affects your lungs, yet it maybe potentially stops that cascade of inflammation, what does that say about someone's lungs and they do have the virus?
We have no clue what it means at this point. The only thing the study really shows is that it decreases the viral loads in the lungs. We don't know if that correlates with decreasing the chance of the inflammatory state. We don't know if that correlates with decreases in the pulmonary findings that a patient may have or the symptoms that they may have. Again, it's promising because this is heading in a direction that we would want it to. We're seeing some early, promising findings that this is having an effect, and it's not nothing. We're seeing a positive effect in this direction. But just looking at viral load, so just looking at the amount of virus that's present in the lungs, doesn't always correlate with hard endpoints like morbidity and mortality. So we need to see that link first before we start prescribing this medication.
And if it's viral replication, what about destroying the virus? Because they're two separate things.
Yeah, I mean, usually the immune system will if you can slow viruses down and make them stop replicating, the immune system will mop it up, or the cell will mop it up that it's infecting. Many other antivirals work by stopping replication, and that's adequate as a surrogate for cure. So that would potentially be exactly what we want. We want to be able to stop replication in order to allow the body to heal up. The faster we can do that, probably the better, I would expect and hypothesize. But again, until we really see that data, phase 2 is still really, really early. But as soon as we see phase 3 study results, that's going to be when we can try and figure out how this can be used on the outpatient side.
Dr. Buehler, I always enjoy talking to you. You have such a great way of putting things into perspective, and I really appreciate that.
Oh, thanks. Yeah, thanks for your time.